Here we're going to have a look at the features of the human skull from externally. First of all, you can see the frontal bone, which is one of the largest bones there are. And you can see how far it extends all the way superiorly. And you can already see an important suture that runs right across here, coronally. So as in anatomy, the name is the game, this would be a coronal suture. It actually meets at this point here with another suture, which is running in a sagittal direction. So that would be the sagittal suture, and the region here also has a name that is called the bregma. We also have the sphenoid bone, which you can actually see from several aspects. You can see it from anteriorly, shining through green here, but you can also see it from laterally and from inferiorly. And of course you can see it from the inside, but we'll deal with the inside of the cranial cavity later on. Here's the maxilla. This part of your face, your visceral cranium. Here's your zygomatic bone. Here is your mandible. You can see the head of the mandible, and the process up here is called the coronoid process. You have within the nasal cavity, you have this bony protuberance, which is called the inferior nasal concha. Some actually call it turbinates as well. There are three sets of nasal conchae or turbinates in the nose. These are kind of like little bony shelves that are hanging off the lateral wall of the nasal cavity. They're covered in mucosa, and one of their functions is to help clean the air by capturing dust particles, but also to moisten the air and warm it up, respectively. Here's our ethmoid or ethmoid bone. And remember, if you're looking at this here within the software packet, you can open this screen, and you can always expand a certain item to get more information about it, as we've done here, for instance, with the ethmoid bone. Yeah? As you can see, this is kind of an odd-shaped bone that's just between the plates of the orbit. Okay, they belong to the frontal bone, and it's in front of or anterior to the sphenoid bone. Okay, I'm not going to read all of this here, but remember that you can always go back to your software and expand the information panel by clicking on these three little dots here.